Welcome to the 2018 Leadership Exchange. I'm Fran Silvestri, the Chief Executive Officer and President. I know for many of you, this will be the first time that you've been involved in IIMHL or the Leadership Exchange. What is IIMHL and IIDL? It began in 2003, and it's a 15-year collaborative of 9 countries and 4,000 key decision makers just like yourself. And we work primarily on the focus of leadership. And we do it in 3 ways. The first way is we try to give you an opportunity to meet with your colleagues from overseas, to find out what they are doing and how they are doing it. Second is we're looking for those very unique innovations and creative ideas so we can rapidly share that from one country to another. And third, we try to promote the leadership of the new young emerging leaders to give them skill sets like change management and implementation science. Thank you for joining us in the 2018 Leadership Exchange here in Sweden. And hopefully, you return to see us the week of September 9th, 2019, when we have matches in Canada and the US and a network meeting in Washington.
Building bridges beyond borders took us a while in Sweden to come up with. There are many kinds of agendas when it comes to mental health, many competencies, but they don't necessarily travel easily together. So we have to build bridges together to really figure out how people can connect easier, building a network, a true strong networks between all the different sectors and persons, and relationships are fundamental to this.
IIMHL is about a group of countries coming together and their leaders having an opportunity to exchange ideas and build those relationships, because it's through those relationships that rapid knowledge exchange can actually occur. This is not just a conference that is about giving information of the latest research. It's about exchanging ideas and knowledge and leadership skills between people in a rapid way because of the strength of relationships that get built through networking.
To bring people together with different perspectives and with different knowledge and with the different experiences, and bring them together and building bridges, trying to understand each other and trying to understand the common challenge that we have.
And I think it's a great opportunity for Europe, for us as European leaders, to show the rest of the world how we're doing in the mental health care field, and that we can share good practices with each other and that we can learn from each other.
But it's more than just taking us from one place to the next. It's actually about the opportunities that it represents. So it doesn't just take us to a destination, it invites us to go beyond that destination and to think about how we could take things back or take things further or build on, what we've learnt or what we've heard about or what we've seen.
To have 2 days of intensive learning where you really get on the ground with other leaders to see how things are done. And you get an opportunity to have very honest sharing conversations, but also learning about models and approaches that really work and get best outcomes. We're branching out. We're not just about traditional service delivery anymore, and our leadership is taking us to definitely move beyond the traditional borders of service delivery.
We have for so long been seen as just a health issue, and one that only people in the traditional mental health field have a role. And I think it's time to show that this is not simply a health issue. This is something for every sector. And I think we're seeing more and more that whether you work in education, you work in housing, you work in businesses, we all have a role, and we need to build those bridges with other sectors, and we need to empower leadership in other countries, in other sectors to do this.
I have learned that there's more similarities between our work, our cultures, than there are differences. There are definitely differences too in different contexts, but the similarities I think are what draw us together, And building those bridges to me are the foundations for making connections that have nothing to do with our borders, but more about the shared challenges and shared solutions that we can have.
And in the past exchange, I was focusing on work that was taking place in Australia. And this time I have the experience of not only focusing on what's occurring in Sweden, but multiple other countries as well, in the UK, in Ireland, in Iceland, and in other places, and to learn about what they're doing and to see what lessons learned are and to try to bring that information back here to the United States.
The challenges facing people with physical disabilities or with cognitive disabilities, they're worldwide. And so we should be looking for solutions that we can apply from community to community, that we can build upon as leaders, take those challenges, share what's working, and translate those into solutions for the worldwide audience. And I think that's a very, very powerful aspect of the International Initiative for Disability Leadership.